Hey there, Lance from the Back Doctor here, and today I'm really excited to talk to you about spinal decompression therapy. This is a gentle, non-invasive, non-surgical way to help relieve back and neck pain that's helped so many of our practice members get back to living comfortably. If you've been dealing with chronic pain, this could be a game changer for you. Let's dive in. First, let's understand what spinal decompression therapy is all about. Imagine your spine as a stack of building blocks with cushiony discs sitting in between, acting like shock absorbers. Over time, due to injury, poor posture, or everyday wear and tear, these discs can actually start to compress, bulge, or sometimes even herniate. What this does is it puts pressure on nearby nerves, causing pain, numbness, tingling, or even weakness. Sometimes you may feel this in your lower back, or even shooting down your legs like sciatica, or even in your neck or arms as well. Spinal decompression therapy is a safe and effective treatment that uses advanced technology to gently stretch your spine and take pressure off your nerves. It's not like old school traction. This is precise and computerized, tailored just for you. So how does it work? The table slowly and gently pulls apart, creating space between your vertebrae. This generates a negative pressure inside the discs, kind of like a vacuum effect. That vacuum can help pull bulging disc material back into place. This reduces inflammation and allows nutrients, oxygen, and fluids to flow back into the discs. It's like giving your spine a chance to reset and repair itself naturally. Think of it this way: if a disc is like a jelly donut being squished and the jelly is oozing out, decompression helps suck that jelly back in where it belongs, relieving the pinch on your nerves. This therapy is great for a variety of conditions, including bulging or herniated discs, degenerative disc disease, sciatica, spinal stenosis, and chronic neck and lower back pain. It's especially helpful if you've already tried other things like medication, physical therapy, cortisone injections, but still not getting the help you need. However, it's not for everyone. If you have severe osteoporosis, recent spinal surgeries, or certain other conditions, we'll discuss alternatives at your next consultation. Now, what can you expect during a session? Each treatment lasts anywhere between 5 and 12 minutes, and it's very relaxing. Many patients even fall asleep. You'll feel a gentle pulling sensation, but no pain. And now the big question: what are the benefits? Less nerve irritation, reduction in pain, better mobility, and a return to the activities that you love to do, whether it's spending quality time with your family or exercising pain-free, and the best thing, without any surgery or any downtime. You might even end up a little bit taller. Studies show it can promote disc healing and long-term relief for up to 86% of suitable candidates. So on your next visit, we'll let you know if you're a suitable candidate for spinal decompression. There are different approaches available when it comes to the frequency for spinal decompression. The very best results will come from doing 24 to 36 sessions. However, there is the option of also doing 12 sessions, which will still provide some relief. These sessions can be weekly, fortnightly, or monthly. We'll give you our best recommendations based upon what we see in your x-rays, what your symptoms are, and most importantly, what your goals are. Thanks for listening. If you have any questions, have a chat to us when you come in for your next appointment. We'll see you soon.